Hello. Hey, it is, what is today? Monday, the 9th of January. And I just decided to come on because I had a little bit of energy. I just came back from a doctor's appointment and I'm laid up on the couch. Gonna take a nap pretty soon. But I had a little bit of an update, so I wanted to let my people know what's going on. So, typically when I go to chemotherapy, every couple of chemo sessions, I meet with my oncologist. But because of the holiday, the chemo schedules got kind of changed around. And because I go weekly now, it's not necessary to meet with my oncologist every week. So my appointment was scheduled for today. And so there's a couple of new things, the possibilities that may go on, and we discussed those. So first off, had my exam. They do a physical exam. So the oncologist, as well as the fellow, my doctor was actually out of the office today. So I met with one of her team members, Dr. Singh, and then the fellow, who is Dr. T. Both examined me, and both of them were unable to tell the difference from the last examination that we had. So we discussed the possibility of a change in treatment plan once I have that ultrasound that's going to be scheduled in about 2 weeks. So right now I'm on Taxol chemo. There were 12 cycles scheduled. I go every week for 12 weeks. What we've decided, and what's the recommendation, is if once I get that ultrasound, if there is not a 30% change or more in the reduction of the tumor from the last ultrasound I had, which was after I finished the adriamycin and Cytoxan chemotherapy, then we would switch me to 2 new medications. They are trial medications, so I would be put in a trial. I can't remember the name of both of the medications. I know one of the medication is called cisplatin. So again, if there isn't a 30% or more reduction since the last ultrasound, or if there's not a significant change, and if it has remained the same, or if there's any type of growth in the tumor, or more inflammation in the lymph nodes, at this point, we would switch me to those trial medications and move forward from there. Now, if there is at least a 30% change in the reduction of the tumor size, then I will continue with the treatment plan that I'm on, the Taxol, and continue out for the duration of the 12 total treatments. So even though we don't know yet, it's actually very nice to know that there is a backup plan. I don't want to get too ahead of myself, but it is nice knowing that, hey, we don't have to scramble in the end if we find out one thing. So it's already set. So that was the main focus of my visit. The secondary focus was the extreme pain that I've been having in my bones. This pain, I've never had a broken bone, so I don't really know what that feels like. However, some days this pain feels like it's so much pressure that it's just waiting for a bone to snap. It's deep within my bones, my joints. It's mostly my lower leg into my knee joints, and it's sort of spread up to my hip. And then last night, I started feeling it in my left arm. And it just, I can't rest. Some days when I'm having an episode, I've cried myself to sleep sometimes. I'm sitting around moaning, and it's just bad. So The only thing we can do with that, because it's probably related to the chemo and its effect on my bone marrow and the nerves, is just pain medication. So they're calling in a prescription for pain medication for me today. And I didn't want to go that route because I'm already on, I want to say, 7 or 8 prescriptions. But I can't deal with that pain, even though it only happens 3 or 4 days out the week. It's just extreme. So I'm going to be taking those pain medications once they're prescribed. The other issue I've been having is bloody noses. I've had some significant bloody noses, and then other times it's just if I blow my nose, because my nose constantly runs, and I'm noticing some blood in that. And then if I have like a little phlegm or something and I need to cough, I've actually coughed up some blood. So they're going to check my platelets when I get my next blood test, my blood draw, and make sure I have enough platelets and that's not an issue. It might just be with chemo, it's drying, and so it dries out the mucous membrane. So that's inside your nose, your nasal passages, your mouth, esophagus, and stomach lining. So it might just be that it's so dry that I kind of just spring a leak. But we're going to check the platelets to make sure it's nothing more serious. What else? So I think that's it as far as my medical update. But I did want to say, because I do share these videos with individuals in my online support group from Facebook, as well as on YouTube. Whenever you're having symptoms, like, it is so important to monitor any symptoms and side effects and make sure your doctor knows. Managing the side effects is one of the easiest ways to get you through the situation. You're going to have side effects if you're on chemo. The nature, the strength, the type, those could all kind of vary depending on the person, but managing them is very important. So the biggest thing, eating. A lot of times people on chemotherapy don't have an appetite. They feel nauseous. They don't want to eat. But you have to maintain your strength, maintain your nutrient load, make sure your body is getting what it needs to fight and survive. I read something a while ago that about 50% of the people who die from cancers, so out of the ones who die, about 50% of those die from wasting. Not even the cancer, it's the wasting syndrome, which is your body is not absorbing nutrients. You start losing weight and you waste away. And so it's very important to stay up on top. The doctors, even if you're overweight, when you're diagnosed with cancer, your doctors want you to maintain a weight. They definitely don't want you losing or gaining. And so eating properly and getting your right nutrition is the key to that. The other thing is, when you're managing your symptoms, if you're feeling nauseous, take the medication. If you have pain, get the pain meds and take it. You want to be able to rest and heal. So those things are important. When me going through this pain, it's affecting my sleep. I'm already fatigued from the chemo and having cancer. And then to not be able to sleep on top of it, it doesn't give your body an opportunity to rest and heal. So stay on top of that. If you're having symptoms like the mouth sores or issues with the mucous membranes, one of the things my doctor prescribed was Zantac to help with acid reflux, a burning sensation in your throat and chest, especially upon eating. If your doctor prescribes it, go ahead and take it. If you're having mouth sores, which thankfully I don't, which also can affect eating, because if your mouth hurts, you don't want to put anything in there. Drink lots of water, Biotin and mouthwash, Dry mouthwash is wonderful. I have dry mouth, but I don't have the mouth sores. It does give relief for a couple of hours, and even that couple of hours is wonderful. What other? Moisturization. Stay moisturized. Chemo dries out your skin. You want to make sure and then you're washing your hands so much to keep germs away. Make sure you're washing your hands and moisturizing them. I did experience peeling on my hands. My hands had turned they had almost turned the same color as the back of my hands. And then they peeled off, and now they're light for the most part again. But it was like thick skin coming off to the point like right now, I don't even have fingerprints. So just stay moisturized in that respect. What else? I think that's it. So yeah, manage those symptoms. If you have, aches and pains and other side effects, whatever they may be, make sure you let your doctor know so they can stay on top of it. Make sure you're getting good nutrition, eating healthy, getting rest. Oh, and staying active if you can. Right now, I haven't worked out in 3 days. And even when I was working out, it was like slow walks and super light aerobics. But just to help beat the fatigue, sometimes it helps to get active and move around and keep the body strong. So be mindful of those. And if you do experience, new side effects, aches and pains, don't panic. Just let your doctor know. I did go into panic mode this past week because when I was first diagnosed, I didn't have any signs or symptoms. I felt the best that I had ever felt. But then I talked to other cancer patients and they say, oh, I knew something was wrong because I was experiencing pain, or my breast started to change. I was super tired. I started having these weird aches and pains. And so I never experienced that upon diagnosis. But now when I get a weird pain like I've never felt before, I freak out a little bit because I'm like, oh my God, is the cancer spreading? Did something change? Discuss it with your doctor. Try not to stress out about it because it just might just be a side effect. So just take note. If you have to make a note in, a journal or something, just make sure you discuss those things with your doctor. So that's my update for today. Go to chemo on Wednesday. My schedule changed, and so now I moved from Mondays to Wednesdays. So I'm gearing up for that in 2 days. And then in about 2 weeks, I will get my ultrasound. Can't wait to see what's going on the inside. So thank you for watching. Feel free to share this with patients or people in your lives who are dealing with cancer, chemo. And thank you for watching. Have a wonderful day. I will see you later because I'm about to go take a nap.